story highlights suicide is one of the top 10 causes of death in the U.S. in 2016. About 45,000 lives were lost to suicide, nearly 15 people for every 100. CNN. Suicide rates increased by 25% across the United States over nearly 2 decades ending in 2016, according to research published Thursday by the U.S. Centers for Disease Control and Prevention. 25 states experienced a rise in suicides by more than 30%, the government report finds. More than half of those who died by suicide had not been diagnosed with a mental health condition, said Drive. Ann Scutchett, Principal Deputy Director of the CDC. These findings are disturbing. Suicide is one of the top 10 causes of death in the U.S. right now, and it's one of 3 causes that is actually increasing recently, so we do consider it a public health problem and something that is all around us, Scutchett said. The other 2 top 10 causes of death that are on the rise are Alzheimer's disease and drug overdoses, she noted. Our data show that the problem is getting worse, Scutchett said. In 2016 alone, about 45,000 lives were lost to suicide. Read more. Increases in 49 states using data from the National Vital Statistics System for 50 states and the District of Columbia. CDC researchers analyzed suicide rates for people 10 and older from 1999 through 2016. Overall, the U.S. experienced a 25% rise in the rate of suicides during that period, with individual states ranging from a 6% increase in Delaware to a nearly 58% increase in North Dakota, the researchers say. All states except Nevada experienced an increase. Although Nevada showed a 1% decrease in suicide, the state's suicide rate was still high, ranging between 21 and 23 suicides for every 100,000 people for the years studied, the researchers say. Suicide rates were 4 times greater in the highest state compared with the lowest when calculated on an annual basis during the most recent time period, 2014 to 2016. Montana experienced about 29 suicides for every 100,000 people, the highest in the nation, compared with about 7 people out of every 100,000 in the District of Columbia, the lowest. As a whole, the nation saw 15 people dying by suicide for every 100,000 in 2016. The most common method was firearm, followed by hanging or suffocation, followed by poisoning, Scutchett said. She added that intentionality is difficult to determine in cases in which a person dies by overdose. Opioids were present in 31% of individuals who died by poisoning. Deborah Stone, lead author of the study and the behavioral scientist at the CDC, said Thursday, "We typically see that firearms make up about half of all suicides. And that tends to be pretty consistent." Scutchett noted that the researchers focused in on 27 states where we have extensive data from the death investigations to try to understand the factors or circumstances leading up to suicide, how to get help for someone who might be suicidal. These data, derived from the National Violent Death Reporting System, showed that 54% of those who committed suicide in 2015 did not have a known mental health condition. Digging deeper, the researchers found that several circumstances, including the loss of or problems in a relationship, were more likely to trigger a suicide among those who did not have a mental health condition. Regions and demographic groups were also compared. Economic factors behind suicide. The Western area trend of high increases in suicide rates could be related to the fact that people in rural areas have less access to services as they more slowly benefit from the economic recovery than other parts of the nation. There may be several, but we knew that economic factors can increase the risk of suicide and that limited access to care, behavioral and social services may also increase the risk of suicide. Recent government reports have highlighted rising rates of suicide among women, Scutchett said. She said, "We don't have all the answers. The percent increase was higher in women, but it's important to say that men have a 3 to 5 times higher rate than women," Scutchett said. The rising suicide rate for women, then, is increasing but at a much lower level than for men. Veterans are also overrepresented in the report, she said. Veterans made up about 18% of adult suicides but represent about 8.5% of the U.S. adult population, Scutchett said, noting that not all veterans who died by suicide were recent veterans. Still, the researchers found a 10% higher risk of suicide among people who had served in the military. Middle-aged adults had the highest increase. "This is a very important population right now in terms of national statistics," Scutchett said, noting the high rates of drug overdose in this group as well as deaths of despair described in social science literature. She believes this group may have been hardest hit by the economic downturn, but she added that unknown factors probably contributed. A wake-up call about what's killing America's young people. We think a key message is there's not just one group, many are at risk, Scotchett said. Whether or not they had a mental health condition, most people who died by suicide had experienced one or more factors that may have contributed, including a relationship problem, a crisis in the recent couple weeks, and problematic substance abuse, she said, alarming. Brian Smalley, a professor of community medicine and psychiatry at the Mercer University School of Medicine, described the mental health care challenges experienced by patients in rural areas as the 3A's availability. Smalley, who was not involved in the new research, pointed out that about 85% of federally designated mental health professional shortage areas are rural. Accessibility and acceptability of care. Due to higher poverty rates, higher likelihood of hourly pay and productivity-based labor, and lack of transportation infrastructure, mental health services are often not accessible even if they are available in a rural community. That is, even though it is there, many people either cannot get to it or cannot afford, either directly or indirectly, to go, he said. Add to that, rural areas have very high levels of stigma surrounding mental health services. Rural residents face lower levels of anonymity in seeking services due to the close-knit nature of rural communities, Smalley said. The possibility of someone seeing your car parked at the only psychologist's office means rural residents are less likely to seek care when needed. Sandro Galea, Dean and Robert A. Dr. Knox, professor at the Boston University School of Public Health, said the National Vital Statistics System is the best system we have of keeping records in the country. Galea, who was not involved in the new study, added that for this reason, the new research should be taken very seriously. There have been previous reports recently that have shown suicide is one of the major contributors to a decrease in life expectancy in this country, which makes it even more alarming, he said. Missing CDC worker's death was a suicide by drowning. Medical examiner rules the paper makes a clear case, correctly, about the fact that there is no one cause for suicide. He said, adding that availability of means makes death possible. A lot of suicide is a one-time effort, so having guns available, for example, makes one more likely to complete suicide, but that in and of itself is not an explanation for why suicide is going up, Galea said. CDC data shows that suicide happens to everybody, he said. Social and life and economic stressors are the ones that create the conditions for suicides to happen. Follow CNN Health on Facebook and Twitter. See the latest news and share your comments with CNN Health on Facebook and Twitter. If you feel extreme distress, you can call 1-800-273-8255, the National Suicide Prevention Lifeline, to speak with someone who will provide free and confidential support 24 hours a day, 7 days a week. The CDC also recommends its own policies, programs, and practices for prevention. If you want to learn how to help someone in crisis, you can call the same number. Beginning a conversation, helping keep them safe, helping them connect, and then follow up with them, she said. Scotchett said there are simple steps anyone can take to help someone at risk. We don't think every single suicide can be prevented, but many are preventable.